Hello, I'm really excited to present to you today on the AmeriCorps Super Coach program, a partnership with University Hospitals. My name is Nicholas Cohen. I'm an assistant professor in family medicine at University Hospitals and Case Western Reserve University School of Medicine. I'm also the program director for the AmeriCorps Super Coach program. Our objectives for this presentation are for you to understand the importance of addressing tobacco use, to learn effective strategies for addressing tobacco use with a super coach, and to review documentation and billing. The problem we have is that tobacco use is the #1 cause of preventable disease and death in the United States. In Ohio, and Cleveland especially, rates of tobacco use exceed the national average. In fact, Ohio ranks 46th in the nation's health rankings, and a recent article in the Columbus Dispatch attributed our high smoking rates to our poor health rankings. Tobacco use in the United States on average is 17.5% among adults. In Ohio, that rate is higher at 21.6%, and in Cleveland in particular, that rate is 38.6%. That is over double the national average. The good news, nearly 7 out of 10 smokers want to quit, and effective interventions, namely medications and nicotine replacement products, as well as counseling, are covered by insurance under the Affordable Care Act. But the challenge we face is in the rates of delivery. In Ohio alone, the rates of delivery are low. Among Ohio Medicaid adults, only 5% received medication to help them quit smoking, only 2% received counseling. Providers cite time constraints as the main reason for not delivering these effective interventions. And indeed, as a family doctor, I can attest to the fact that with 15 minutes, it's difficult to address tobacco use. And with nearly 1 million people added to the Medicaid rolls in Ohio, it makes it even harder, given the fact that we don't have any more physicians to take on these new patients. If we visit your practice for a presentation, you can request data specific to your practice and specific to the providers. We can provide you with quality metrics so you can see where your practice and where you as a clinician stand with regards to the important tobacco cessation metrics, including the percentage of smokers in your practice, the percentage who are provided brief advice, the billing that's done for that brief advice, the percentage of your smokers who are on pharmacotherapy to help them quit, as well as the percentage of patients who are referred to our counseling program. I've given you background to the importance of tobacco use and the challenges we face in delivering effective interventions. This brings us to the AmeriCorps Super Coach program. This program is a collaboration between AmeriCorps, a national service organization, and university hospitals. As a primary care doctor who sees patients who smoke at a rate of 32%, I knew that this was an important issue to address. But I also see between 3 and 4 patients an hour, and I knew that I didn't have a way of providing more time to address this important issue. This was the impetus of bringing these national service members onto our clinical teams. They are unbound by time constraints. They are highly trained in motivational interviewing and tobacco cessation counseling, passing objective, standardized assessments of their skill, and periodically undergoing evaluation to ensure maintenance of competence. And they are passionate about making a difference. And they bring this passion to every smoker that they work with. The model we have, providers offer every smoker they see brief advice to quit, pharmacotherapy, including nicotine replacement products, and referral to a coach. Providers bill for the 4 to 10 minutes of counseling. Coaches can either see your patient at the site of care via secure telehealth technology, or call your patients after the visit. And the coaches can then call again for follow-up with 1 or more calls based on the patient preference. And our outcomes are impressive. Providers are 10 times more likely to address tobacco use when they have a coach who they can refer to. One provider in our system billed over $13,000 in 2017 for counseling, and the quit rate at 6 months is 30%. This is in comparison to a quit rate for people who do not receive help with quitting, which is about 3 to 6%. And in the literature, a quit rate of 23% for motivational interviewing in particular. Here I provide a sample script for providers. I've been doing this for over 2 years, and I've been shot down a number of times with various ways of approaching the topic of tobacco use and referral to counseling and pharmacotherapy. Here's what's worked for me. Ms. Jones, we discussed your reasons for coming in today and our plan. Would it be okay if I talk to you about your smoking? How much do you smoke? Quitting smoking is the most important thing you can do for your health. It can add up to 10 years to your life if you quit and can help you control your diabetes. This was a patient I had seen for diabetes. Quitting smoking is hard, but we have a great program here to help you quit. I can prescribe the patch and the gum. This is free with your insurance, and it triples your chances of being successful quitting. These products have the nicotine that you like from smoking, but none of the chemicals that cause health problems. I also really recommend I have one of our tobacco cessation coaches call you. They can give you some tips for using these products and share strategies that have helped others quit. I highly recommend them. Can I order these products for you and have a coach call you? Great. Let's follow up in a month to see how it goes. Does that work for you? There are some best practices I have that I illustrated in that script. I wait until the chief complaint is addressed. Rarely does someone come in because they want to quit smoking. They come in for another reason. And if I try to address smoking before I address why they came in, it often leads to frustration and refusal to address their tobacco use. I also will connect their presenting complaint to their tobacco use. Almost any condition that people can come in with is connected to tobacco use, from back pain to poorly controlled diabetes. I provide them with a strong message to quit. Quitting smoking is the most important thing you can do for your health. It can add up to 10 years to your life. And I offer pharmacotherapy and counseling. So I'm treating this as a chronic disease. The literature has shifted over the years towards a chronic disease model for tobacco cessation. If you see a patient for high blood pressure, you don't ask them, do you want to control your high blood pressure? You just say, you have high blood pressure, we've got medications, I can refer you to a nutritionist, we can see how it goes, and we can follow up from there. And this is actually the strategy that's being adopted more and more by providers for tobacco use. Do you smoke? Yes. Okay, here's a patch of gum and some counseling. Let's see how it goes, and you can follow up with me. So the idea of not predicating these services on a person's decision to quit or asking them for a commitment to quit before talking about and offering those products is increasingly proving to be the more effective strategy in primary care. And finally, I always arrange follow-up. To have a visit, usually in a month, to specifically address how they're doing with their quit attempt is highly effective for conveying that this is an important issue to work on and that you want to be able to help if things don't go well. I just have a note here about combination nicotine replacement therapy. It is my go-to treatment for smokers. It does triple a person's chances of quitting, rivaling varenicline, which is really the most effective pharmacotherapy for tobacco cessation, but without any of the concerns of adverse effects or contraindications. And again, I don't wait to find out if the person wants to quit. And the FDA warning about not using a patch when you smoke or not using gum when you smoke was removed in 2013. The FDA concluded that it's safe to smoke while using the patch or chewing the gum. Another advantage of combination NRT is that it's covered by insurance. And finally, I want to point out that I'm prescribing for 6 months. The standard dosing on the package label is for 10 to 12 weeks, but there are studies coming out now that show that there's a higher rate of successful quit attempts at 6 months with a 6-month duration of combination nicotine replacement therapy. A little bit more of the specific information about prescribing the combination patch and gum or patch and lozenge. For the patch, you determine how many cigarettes they're smoking, and I count a black and mild as 8 cigarettes. If they're smoking 10 or less, then I prescribe the dosing as listed below. And if they smoke more than 10, I prescribe the dosing listed under the second item. For the gum, and this is the same for a lozenge, I determine the dose based on how soon after they awake they have their first cigarette or black and mild. If it's within 30 minutes, I'll prescribe 4 milligrams. Otherwise, I'll prescribe 2 milligrams. And here's some more information about instructions for using the gum and the lozenge, as well as the total number of pieces I'm prescribing. I'll now turn the floor over to Angela, who will describe what she does when she's working with patients. She's one of our outstanding super coaches working with us this year.
Hi, I'm Angela, and I'm one of the super coaches. Today I'm going to talk to you about what I do when I actually talk to a patient. So first, I build up their motivation and confidence to quit smoking. Second, I help them set a quit date. Third, I explain how to use the nicotine replacement therapies that they're prescribed. Fourth, I help identify their smoking triggers. Fifth, we work on developing strategies together to deal with their smoking triggers and anticipate future obstacles. And finally, I provide continuous follow-up. One example of a patient I talked to is a woman who smoked half a pack a day. She rated her importance for quitting smoking to be 10 out of 10, but her confidence was only a 5 out of 10. Thus, she was really motivated to quit, but she needed some guidance. First, I helped her set a quit date. Then I discussed how to use the nicotine gum properly. After that, we discussed her smoking triggers, which were stress and boredom, and developed some behavioral strategies to cope with them. After a few follow-up calls, she quit. When we asked for her feedback at the end, she said she really appreciated this program and she liked having someone to talk to and support her on her journey to quit smoking.
Thank you, Angela. That was a great presentation. Angela's been highly effective in helping smokers quit. Her enthusiasm and professionalism have gone a long way in helping people on this journey. So, if you see a smoker and you offer them a coach and they want to have someone follow up with them and you don't have the telehealth technology in your clinic, you can email supercoach@uhhospitals.org. Please include the referring provider, the patient's name and medical record number, and also, ideally, the best time to call the patient. In this video, I'll describe how to document and bill for tobacco cessation counseling and treatment. First thing you do is you go to social history and you make sure that tobacco use has been assessed. If the person is a smoker, you click on the pad icon. And you then click on the care guide. Here you will provide the patient with educational materials, which counts towards meaningful use. This will get printed with their clinical summary. And you can also order your nicotine replacement products from this window. Then you click OK. Under Orders, we'll go to Procedures and click on the amount of time you spent and whether their presenting condition was related to their tobacco use. And then when you are submitting your charges for the visit, you go to MD Charges, just like you would normally. For visit charges, in addition to their billing code for the visit, you're going to select this top tobacco cessation option, and this is code 99406. You're going to also select the modifier group 25, which is not available in this test record. The key points about this video. 99406 is the CPT code for tobacco cessation counseling. It's reimbursable for up to 8 visits per year, and the 25 modifier is appended to the primary E&M visit code. In summary, tobacco cessation interventions are important and underutilized. The AmeriCorps Super Coach program makes addressing tobacco fit into the time-constrained outpatient visit. Email us at supercoach@uhhospitals.org to place a referral if you don't have the telehealth technology set up. Documentation and billing allows us to meet meaningful use requirements and increase revenue for practices, and quit rates at 6 months are 30%. Thank you for your time. Have a great day.